Namaste friends, myself Dr. Dhaval Dharani. I am working as an infertility and fetal medicine specialist at Paaranu Women's Super Speciality Hospital, Gujarat, Surat. Today I am going to show you the procedure known as a cord coagulation from our fetal medicine department. Just brief introduction regarding the patient. She is a primary gravida, IVF conception, previous pregnancy with the twin gestation. As we have done the sonography at the 3-month anti-scan, it was absolutely normal, and we have diagnosed that she is having the monochorionic pregnancy. Twin to twin transfusion syndrome is a common complication. Around 15% of the monochorionic pregnancy has a such complication. So we have advised the patient to follow up regularly every 2 to 3 weeks after 16 weeks. Right now, she is 19 weeks of pregnancy, and when we have done the sonography, we have seen that patient is developing twin to twin transfusion syndrome. What happens in this syndrome is that one twin gets more blood supply and another twin gets the less blood supply because of the abnormal vascular connection. So gradually the donor twin develops the oligohydramnios and recipient twins develop the polyhydramnios. This is the first sequence, followed by gradually changes in the blood happens, blood supply happens, Doppler changes happen, and later on in the last stage one or both twin gets demise. So after explaining to the patient, we are given two options. One is a laser ablation where we separate the placenta and both the twin can continue the pregnancy. Another second option which we have given and which I am going to show you is the cord coagulation. We are the only center in the South Gujarat who are doing this procedure. In cord coagulation, what we do is that we coagulate the cord of the recipient twin and will allow the growth to the donor twin. So recipient twin, we are going to sacrifice the recipient twin, and we are allowing the pregnancy of the donor twin. How we do the procedure? Patient is under general anesthesia. We introduce the 3 mm trocar and through our bipolar to the maternal abdomen to the inside the amniotic cavity, and we hold the cord between the two prongs of the bipolar and will give the bipolar current and will stop the blood supply to the recipient twin. And this is around 30 to 40 minutes this procedure will take, and later on after 4 to 6 hours when patient is stable we can advise her to go home. So let us see the procedure of cord coagulation. Now you can see in the ultrasound image there is a one stuck twin or donor twin, which is a twin A, and twin B or the recipient twin. You can clearly see the oligopoly sequence. Stuck twin is having the oligohydramnios and recipient twin is having the polyhydramnios. This is a monochorionic pregnancy. You can see the stuck twin has no activity as such, while the recipient in the polyhydramnios twin is having the continuously movement. Now I am passing my bipolar. Patient is in under GA, and through the 3 mm trocar. After trocar and after removing the cannula, I will pass my 3 mm bipolar inside the mother abdomen, and my trocar, my bipolar is right now inside the uterus. You can see that clearly see the prong of the bipolar, two prongs of the bipolar with the bright light you can see. I am trying to hold the cord in between the two prongs of the bipolar. It is a little bit difficult or require a little bit skill because we are seeing in two-dimensional image in the ultrasound, and with our hand movement we are trying to hold the umbilical cord in between the two prongs of the bipolar. Now you can see that I clearly hold the umbilical cord between the two prongs of the bipolar. I am passing the bipolar current to the umbilical cord. You can see the flumes Flumes are coming out of the bipolar prong. It shows that current is clearly going to the umbilical cord, not to any other structure. After giving sufficiently current, we'll stop the bipolar current and we see the heart activity. It's obvious that it's immediately we will not see the sudden stoppage of the cardiac activity. Sometime there will be a little bit of blood passing through the heart and the vessels. So in the color vision we'll see the blood going through the vessel and we'll see the bradycardia also. After holding the cord for some time, I'll remove the cord from my bipolar. I'm trying to little bit remove my bipolar and I will see again the heart activity. You can see there is a little bit of bradycardia is there. Still the heart has not stopped completely. It will take around 3 to 5 minutes around to stop the cardiac activity completely after complete coagulation of the cord. Sometimes we require one more attempt to the coagulate cord if it has not coagulated completely. You can see the heart is having the bradycardia, but still the activity is there in the recipient twin. I am putting the color Doppler to the umbilical cord. There is no blood flow as such to the cord. This is a color is showing because of the movement. You can see that there is a bradycardia is there still. Now I am putting the color box upon the umbilical cord. You can see there is no flow of blood through the umbilical cord, and inside you can see the heart activity in the donor twin, which is a stuck twin. It is completely normal. So we have coagulated cord to the recipient twin. Now you can clearly see there is a severe bradycardia. Little bit of heart activity is there. And now it has stopped almost completely. So here we have coagulated the cord of the recipient twin, which is a twin B and which is having the polyhydramnios. Stuck twin is donor twin is absolutely normal, cardiac activity is normal, and we will follow up this case. Cardiac activity is normal, and we will follow up this case again after a week. And most of the time, once the cord is coagulated, the donor twin or stuck twin gradually the liquor become normal in that sac. Thank you.